Good morning. My name is John Nguyen, and it is my honor and privilege to serve as Chief Marketing Officer for SSM Health. Today, I am up here to introduce and moderate a conversation with our final speaker of the conference, our President and CEO, Laura Kaiser. So are you regretting letting me do this yet? So Laura, to start off, what's been your favorite part of the conference so far?
Well, I can tell you this is my least favorite part. Does that work? I'd rather listen to more stories and just have conversations with everyone. It's so remarkable. And I'm learning things about our ministry because there are so many pockets of excellence and so many pockets of beauty and goodness, and I didn't know anything about the Treffert Center until a couple of minutes ago, and so now I want to go talk about that. Is that okay?
No. We've got 30 minutes on the clock, so you're stuck here with me. So in the talk show business, this is what we call the softball questions at the beginning. We're going to start with some personal questions, despite the fact I know you don't like to talk about your personal life too much, but we know, it's become well known, I think, that you are a lover of animals, painting of elephants in your office. You support the Elephant Foundation, as well as I know you have a number of pets. So where does your passion, your love for animals come from?
Well, I was raised with cats. My parents, we had a couple cats when I was little, and there were always, neighbors had dogs and cats, and back in those days, I know I'm about to sound like I walked to school barefoot in the snow, but it was a while ago where in the evening, my mom had a dinner bell. It was just a bunch of bells hung on a string, and she would ring it, and we'd all come running from wherever we were in the neighborhood, and the neighborhood dogs were there. And they were always super fun, and I think it just comes from the idea of we're all creatures here on this earth together, and God asked us to be the stewards and to look after one another, and that includes animals. And so I can remember when I was in high school, kids do dumb things, and there were some kids on the bus that had a little frog, and they put a rubber band around its back legs, and they threw it out the window. And I was beyond furious. I was so angry because I thought it was bullying, and it was unfair, and I didn't understand why a simple frog who hadn't done anything to anyone and didn't deserve that received that treatment. And so it's deep inside of me. And the other part is, and so I feel a responsibility to help them. And so many of you know we have a number of dogs and some cats, and they're all rescues, and I also feel a little selfish about that because when I come home, it's the best moment ever for them. They're always so happy to see you no matter what, and so it feeds my soul and the rest of the families as well.
Awesome. So speaking of stewardship of creation, our founding sisters, the Franciscan Sisters of Mary, are passionate about preservation of the earth, and that's something you're passionate about also. I remember I was sitting in the audience when you announced that SSM Health would plant 1,000 trees in our communities, and then I said, how are we going to do that? But to date, that's actually looking more like 3,000 trees that we'll be planting in our communities this year. So why is environmental sustainability important to you and important to us as an organization?
Well, it's actually related to what I just said. I think of us as this amazing planet that we were given at creation. And we've been asked to be good stewards of the planet. And it is finite. I know it feels limitless at times, but it is finite. And so we are responsible for leaving it better than we found it. Mm-hmm. And we're not doing a great job at this point in time. I would never be a good elected politician because I absolutely believe that climate change is happening. And so, and we need to do better things about it. So in whatever small way, each one of us can have an impact. And it just seemed, it's so congruent with who I am, the foundations of this ministry, the deeply embedded beliefs of our founders are congruent with who I am. And so when you have a platform, and we are a platform together, we use it. We use it for good. And so the idea of trees being planted is good because they help to improve the air quality. It's why we're involved in the Adopt a Roadway. It's why I just wrote something recently. I'm a little bit on Facebook only because I kept hearing about things that were happening in my family from other family members because I was looking over their shoulders at Facebook. But I put something on it recently that was, what if every one of us picked up a piece of trash as we walked past it? Just one piece of trash. If we all did that every single day, the world would be better, and we'd all be great examples. So I just think that we have a responsibility to be better caretakers. And so whatever else we can do, there will be more to come, but there's a lot that needs to be done.
Sure. The conference so far, we've been talking about connecting to purpose and our mission, and obviously preservation of the earth, care for our patients is how we live out our mission. So, as the days pass and we've heard these inspirational stories, what kind of inspires and motivates you about our work or in your personal life as we kind of look to the future and what's to come?
Let me say one other thing about preservation of the earth, because it's a factoid that I read not long ago, and it's stayed with me. You've all heard about the plastic islands that are out in the middle of the oceans. Unbelievable. And I was reading an article about that in terms of what we can each do about that. And the factoid was, by the year 2050, which was really just around the corner, it's anticipated there will be more plastic in the ocean than fish. That is not okay. And we have to get really busy right now because I think it's still retrievable, but it's increasingly irretrievable. So that's another part of what just drives me. So
absolutely.
Purpose. I talked about it yesterday. I was really fortunate, and not everybody has the same good fortune that I had in being brought up in a loving family with great role models as parents. So I'm wired to be of service. I'm a servant leader. I want to be all used up when it's said and done. And this ministry, I get to bring my whole self to work to be of use, to be a servant leader, to give back, and to have made a difference. And so I'm the luckiest. I'm the luckiest because not everybody gets that opportunity. Sure. There is a reason it's called work, and I'm sure in your truest moments there are days when you're thinking, I have to go to work today, in the worst sense, because there are some hard parts of work. But for the most part, if your work is a joy for you and a blessing, you're better at it, and you're very, very fortunate.
Yeah. Just to be clear, I never feel that way,
Oh, excellent.
We're always excited to come in and see you. There's been a lot of talk about, obviously, we think about healthcare reform, changes happening in the nation, and our role inside of that. And so, sometimes it seems like the desire to deliver kind of high quality and an exceptional experience of care to our patients might be kind of contradictory to the idea of making care affordable and sustainable. And so as we kind of look down that path of trying to achieve both, what do you think we should be doing, and how do we achieve that as a group?
Well, so first of all, I think it's AT&T that has a number of commercials that are out right now about just okay is not okay, and they have some funny examples of how mediocrity is not okay. And so for us, sure. In business terms, our product is healthcare. We provide healthcare, and we do that at SSM Plus, which is what all of our conversation about presence is, and being present. And so I don't think of it as an either or, it's and it has to be affordable. So in our country, and you all know this, we're consuming more and more of the GDP, and that includes us at SSM Health, and it's not sustainable. And so I think that the general public is appropriately becoming increasingly frustrated with all of us in terms of not fixing what is wrong in healthcare, and we need to really continue to actively endeavor to reduce the overall cost. So we're doing that, and we've had a lot of efforts underway, and I thank every one of you in this room that has had a role in that over the past few years in really ensuring that we are not just working hard, because I know that we all work really hard, but we have instituted some productivity standards which have not been completely popular, but they are helpful to have some benchmarks and frameworks by which we are sure that we are staffing safely and affordably. And also that we are smarter about our supply costs. It's our second largest expense. We have a spectacular supply chain team, many who have been in place for many years and others that have joined in the past couple of years. And we're working at reducing our overall supply costs on those things that we have control over. You know about the pharmacy costs that just continue to escalate. And for those of you that were in the forum yesterday with John and with Carter, Carter talked a little bit about the Civica, which is one effort to reduce the overall increasing prices and unaffordability of medications that people need. So there's not a magic answer, but it's just every single day, one foot in front of the other in terms of how do we manage our expenses as well as we can? How do we assure that people are being served where they need to be served and not in very high expensive settings when what they really need is something that is at a different level than the acute care. So we're going to have to continue to modify and be diversifying and present in various locations, which is pretty exciting about the idea of helping people stay well and preventing the need for an emergency department visit because they're preventable, manageable chronic disease can be better managed if we can help all the way across. Multifactorial.
So I'll make it a little easier for you and kind of turn the tables, because this is a question you asked me in one of our first meetings today, or our first meetings when we've met. I'll be the kind of fairy godfather, I suppose, in this scenario. But if there is one thing you could change, I'll regret that. If there's one thing, if you could kind of snap your fingers, if there's one thing you could change about the American healthcare system, our industry today, what would that be?
So I was recently asked that question when I was up in New York talking with an interviewer from Bloomberg, and it was instantaneous. I still think it's I'd actually like more than one thing, but I can only answer one. I'd realign the payment system. Our healthcare payment system is a very complicated, clunky one, so that it's really right now aligned around doing more. And the facts are that there's a whole lot of healthcare that's happening that isn't actually needed. There's a whole lot of payment for services that are in fact needed, but there's a whole lot of services that are provided that are not paid for. And so I would work more towards alignment around primary care, keeping people well, preventive care. I'd also have more payment realignment around end-of-life care, palliative care, hospice care, and also senior care and behavioral health, all these incredibly important facets. We've heard all these different stories, these very human stories, and there are areas that are just not being paid for. And someone mentioned in the past day or so about, or maybe it was at the board meeting earlier this week, the payment system where we've been allowed to shift some of the payments to different places because that's how the payment's currently set up to pay for things that aren't currently paid for by the system. That's shrinking because payments are declining overall in this country. So we've got to really think about as a country how we're going to pay differently. And that's what I would do. There are a lot of people talking about it, but we have the most complicated healthcare system in the world, and there are others that do it well in a simpler way. Not completely perfect by any stretch, but there are lessons that we can learn.
Sure. So, conferences like this, opportunities to talk and gather, are a lot about retaining and building our culture. It's something we discuss a lot as an organization. How do we establish a culture? How do we be mindful of our mission inside of that? And I think that culture is a big part when we kind of look at how do we bring more people to the organization. I think we all know that there's more competition than ever for talent inside of the healthcare industry. And so let's say, I'll make you a recruiter for the day. You were meeting with a prospective caregiver, physician, professional that's looking to join SSM Health. What would you say? What would you tell them is different about SSM Health versus other organizations out there?
I think I recruit every day, and I think part of it is what we've talked about, what is here, what we have all felt in terms of we do provide exceptional health care and we are present. And so I think that's pretty remarkable. I've had the opportunity. I'm old, and so I've worked in a lot of different places and some remarkable organizations. It's really wonderful to be able to bring your whole self to work and to work alongside team members who are leaning in as well. And so it's pretty remarkable. And I've said to more than one person, take a look. It's a pretty compelling story that's here. It's pretty compelling what's happening here at SSM Health. And by the way, all of you are recruiters as well, whether or not you know it, because people observe you. They watch you to see what is it that's so special about SSM Health? Why is this person at SSM Health versus anywhere else? So we have that collective responsibility, but I think it is about actions speaking louder than just words.
Mm-hmm. And so, with all of the influencers here, it's an opportunity for us to think about how are we kind of cascading those messages across the organization and everybody's role in what it looks like and bringing more people to the organization.
Yeah, so I would, when we were talking, I was thinking about, because this really is my least favorite part. I'd rather just talk with each of you and learn more about each of you. But I was talking with John yesterday and thought for some of the questions, which he did not give me in advance, by the way.
I did not. I was still writing them last night.
Yeah, so, but I thought, I'd really like to hear what some others in the audience think about some of these questions. This is one of them. I'd like to know about, especially from the influencers, among your colleagues and peers every day, coworkers, what do you think about how do you tell the story of SSM Health? How do we recruit? We need to make sure, obviously, that we have competitive market rates, that we have remarkable, healthy culture, et cetera. But what would you say? Is there someone that will give us their opinion as well? Some brave soul?
Looks like there's a hand over there. Do we have a handheld mic? We can bring over.
And tell us who you are, because it's hard to see.
Yes.
So my name is Pat. I'm a nurse in interventional radiology at St. Mary's in St. Louis, and I was chosen as an influencer. And to be at this conference has been an amazing opportunity for me. I think I speak for a lot of us when I say that. And it has opened my eyes to things I never knew. And so I just want to thank you for including us in this, because it's a huge, big deal for me. I've been working at SSM in different incarnations since 1991. When I came to work at Cardinal Glennon in 1991, I felt like when I walked in the door, I was struggling, looking for a job, trying to find my place. I sort of walked in and I felt a weight leave my shoulders, and I felt like I had come home. And I felt that way at every SSM. I've only had 2 jobs in my nursing career at SSM, but I've had care at SSM, I've had surgeries at SSM hospitals, I've had a number of procedures done at SSM hospitals, and it always feels the same way to me at every one of them. The people care, the people are amazing, and they're here for a greater, I'm here to work, I'm here for a paycheck, but I'm here for more than that. When I know people who are looking for a work, I always recommend SSM. Great benefits, great, for me, it's a very fair salary, but it's more than that. It's people, and the people who I know who work at other healthcare systems in St. Louis don't say that.
Thank you. Thank you. It's great to hear. Yeah. It's great to hear.
That's awesome. Anybody else? Anybody? Hard act to follow.
Good morning.
Oh, yes.
I'm Avis Eaton, and it is really a wonderful pleasure to be here today. I'm the System Nursing Talent Acquisition Leader, and I do travel all around the United States, attending all of our national specialty nursing shows. And I think as I'm talking to the nurses and they come up and they ask, well, are you a travel company? Are you this? Are you that? That I get to share a wonderful story, because I personally know our nursing leaders out there in our markets. And what I share with them is, you matter to them. It's about our culture. It's about the people. It's about being able to sit down and talk with a patient, to pray with a patient. 3 years ago, when I was in the Jefferson City market, I had the opportunity just to do what I call personally recruitment rounding, because I really like to be in touch with the nursing staff. And as I was walking down the halls doing that walking round, I looked into a patient's room, and I saw this patient crying, and she was an elderly woman. And so even though I'd been away from the nursing bedside for a long time, I still knew that I could talk with her, and hoping as I walked in the door that I could make a difference in her life. So as I went into the room, I asked her if she was okay, did she need anything? And you know what this patient wanted? She wanted someone to sit and talk with her. She wanted someone to read a specific scripture to her. And I was able to sit there and touch her hand and read the scriptures that she really wanted to know about. And you know what? That's what we're about. We're about our patients. We're about exceptional care. So when we talk about that out there, I'm very passionate about what we do. This is a great place to work, and I'm really honored to be here. And I hope that you take away many wonderful things and know the purpose that you have being part of our organization. Thank you.
Wow.
Okay.
So that's what all in looks like. Thank you. That's so awesome. Really great. Wow.
Okay. While I know that secretly you would prefer we continue talking to other people, that's not really my job here today. So, we talk a lot, especially with everything that's going on, about where's SSM's future, and where do we go, and what does our health system look like? So, give me your thoughts. 10, 15 years from now, you're looking at SSM Health. What does that look like, and how is that different than we look today?
So obviously, we all know that there's a few things, a little bit of change happening in the industry overall. And we need to continue to evolve to be relevant in that evolving industry. But there are some pretty significant immovables in that regard, things that we can each count on, and that is we will continue to be true to our mission. Our mission is what grounds us. It is our foundation fund, everything that we do. Secondly, and we're talking about this with our health ministry sponsor and also at the board level, just in a meeting earlier this week and previously and in meetings to come. Secondly, we are a Catholic health ministry. We will continue to be Catholic. You absolutely don't have to be Catholic to work here, but our value set needs to align with you, and if it doesn't, you'll leave, and that's okay. It's not for everyone, but I don't see a lot of people leaving because the values are pretty compelling, and we're an organization that welcomes inclusiveness and diversity. Thirdly, I think it was really said well by one of the earlier speakers about the idea of meeting people where they are. We will take care of everyone with special attention to the poor and vulnerable, and we will continue to endeavor to meet people where they are, which means to me, I think we will continue to evolve into what Pope Francis has talked about as far as the idea of a field hospital. There will always be a need for acute care. But the idea of helping people stay well and meeting them where they are means that we need to continue to evolve. And we have a tremendous amount of non-acute care work that's underway in our ministry now. But I expect that will continue to evolve to meet the needs of those who are counting on us to do so. So that's a very high-level, broad brush, and we'll fill those pieces in. But when I was asked to join all of you a couple of years ago, and I can't, by the way, believe it's been more than 2 years.
Yeah,
it's been so quick.
Quick.
I was asked to come here as a change agent, and change is scary to many, and I just remind all of us, including me, I mean, there are some things that are a little uncertain, but together we'll sort it through, but I'll just remind everyone of what I've said before. Actually, people don't dislike change. People love change as long as it's their idea. So we have to make this our idea in terms of how we want to define and redefine our ministry in the context of what is needed to provide excellent health care in this country. And so we're on it together.
So, I know we're running a little bit short on time. I'll try to get one more in here. So, I am sure that you'll continue serving with SSM for the next 60, 70, 80 years. But
that is a scary thought.
When it's time to hand it off, and we have a lot of young leaders and emerging leaders here with us today. What is your hope for the next generation of healthcare leaders as we're looking to the future?
It's really simple. I believe strongly in helping every individual reach their potential, because when you do that, so goes the organization. So we have work to do in continued leadership development, continued employee development. I have a little picture that I found many, many years ago that hung in my youngest bedroom for a really long time, and it's made of little snowflakes, which I don't know how many of you were good at cutting out snowflakes, and then you could do this and they'd open. I did that and they all fell on the floor. But I bought a picture of them already made, and it says, "Children are not meant to be molded, but rather to be unfolded." And I think about that a lot in terms of that's true for all of us. We're all big kids. And so if we can help each one of us and those who are part of our entire health ministry reach their potential, so goes us together.
Excellent. Okay, so we are coming to the end of our time here, so I have assembled a special lightning round of questions. These are scientifically proven. I consulted with our behavioral medicine team that in answering these questions, we'll all get a very complete picture of who you are. Oh boy. So with these, they may seem trivial, some of them, but it's very deep insight. So this, the lightning round works really simply. As regular watchers of this program, I know you're familiar with it, but I'll just list two things, and then Laura will state her preference for which out of those two things. For example, Coke or Pepsi, an easy one to start with.
Oh, are we starting?
Okay. It was an example to start.
Neither. It would have to be Diet Coke.
Diet Coke, okay.
Thanks.
And it's a lot of support. Or another easy one to start with, favorite senior leadership team member, me or Damon?
I feel like I'm surrounded. I'm being lobbied pretty heavily.
I decide what questions come next. Okay, so lightning round to finish us off. Okay, Beatles or Rolling Stones?
Beatles.
Good pick. Cats or dogs?
I'm not looking for affirmation, John. Oh my gosh. Good answer.
I'm keeping count. We're going to discuss these later. Okay, cats or dogs?
I don't like these questions. So, if I say dogs, no, please don't tell the cats. Or if I say cats, don't tell the dogs. So, I love all of my dogs and cats equally, just like kids, right?
Such a politician's answer. Okay, in the car, music or talk radio?
Music.
Introvert or extrovert?
Both. Both. Let me
Early
explain
riser?
that.
Oh.
What I mean by that is, there's the whole, see, he's not liking this because I'm messing up talk now. I'm messing up his lightning round. But what I mean by that is, I have to think about how I feel about things. Some people process strategy in real time with a whole bunch of other voices, and I take all of those in, but then I have to think about them in terms of how I feel, and then I'll speak. But when I'm out and interfacing with all of you, I'm extroverted because I'm just pulling in, and so it's a little bit of a mix if you think about Myers-Briggs.
Sure. Okay, this is an important one. Curious George or Clifford the Big Red Dog?
Well, now you're just dating me. Curious George.
I didn't think you would know Zubumafu, so I thought. All right, where would you rather go, Tokyo or Paris?
Tokyo.
Good pick. Sorry, super pop. Okay, there's a common one. Invisibility or flight? as far as the superpower goes?
Flight. Absolutely. I just flew over Dubai in a squirrel suit. It was really fun. It was really fun.
Favorite weekend activity, completing a triathlon or sitting on the couch with a bag of Doritos?
A triathlon. Absolutely.
Fiction or nonfiction?
Nonfiction.
Okay. At a movie, candy or popcorn?
Popcorn.
Okay. Early riser, I think I know the answer to this one. Early riser or night owl?
Early riser.
Okay. And then
I
last
celebrate. My husband and I celebrate now as we're aging. When we get past 10 p.m., we think, double digits, yay, we made it. It's so bad. It's
okay.
true.
That's probably enough. We've learned plenty there. So
Thank you.
we've got. I'm so glad you're a Curious George fan. That's my one secret tattoo. No, so just with the last few minutes that we have, there is a tremendous amount of change going on. There's a lot of redirection and looking to where we're headed in the future. There's not a lot of opportunities. There's 500 gathered here, but there's 40,000 of us across the system. If there were someone, a caregiver, a team member, a physician that was looking for how do we stay inspired, how we stay motivated, how we stay focused with all the challenges coming ahead, if you could give them, a piece of advice directly, what would that be?
I think it's actually the title of this conference, Connect to Purpose. We all have moments where we get tired and we need to rest. You have to take care of yourself. On an airplane, I used to wonder about when the air comes down, the flight attendant will tell you, put the air on, take care of yourself first, and then you can take care of your kids or someone that needs some assistance. And I used to think about that a lot because I'm a servant leader, and I thought about, well, I'd be wanting to help everyone, and then I realized, well, if I'm unconscious, I can't help anyone. So you do have to take care of yourself. It's not selfish. It's about being well so that you can, in turn, help others. That's purposeful. So I think it's the theme of this conference. When you get tired, take care of yourself, get the rest that you need, and then come right back, because our purpose, our reason for being here in this ministry is so much larger than any one of us, and we each need each other to do this together. It's really important and beautiful work.
So this will be my last comment, and you're not going to like this, I'll tell you in advance, but it truly is a pleasure to serve this ministry and to work alongside you and with you. So let's hear it one last time for Laura Kaiser.
Thank you.